Hi there, welcome to this presentation on healthcare data analytics for improved patient care. We have an interesting lineup for today and I trust that you will enjoy it. We will be looking at an introduction to the topics covered, which includes statistics for the Health Services Authority, the steps to provide statistical insights, and the data collections and integration methods that were employed. We also dive into the cleaning and pre-processing of data and take a look at the descriptive analysis on data and the insights that were generated. As the incoming statistical officer, I will show you how data can be leveraged and used to provide insights that the relevant stakeholders can use for making data-driven decisions, and in so doing help to provide improved services to the patients receiving care. But before we get to the insights generated by our analysis, I will briefly go over the steps that are involved. To begin, we will look at data collection and the various sources of such data. This data can be in-house data generated from daily transactions carried out within the organization and provided to us in a spreadsheet such as Excel. But there may be other ways of generating the data, such as studies based on observations, surveys using questionnaires, and real-time data. There are also external sources which generate data from research, patient surveys, and interagency government databases. While looking at external sources, we may want to consider peer-reviewed data from sources such as the WHO, the NIH Patient Surveys Database, and the National Library of Medicine, among many others that are present in the medical field for free use. The data available from these sources may come in distinct formats such as Excel, CSV, JSON, XML, text, and HTML. The data can be retrieved from these sources by means of APIs through HTTP requests via their websites from which we can download selected datasets. There are numerous ways to collect open source data that is in the public domain. We can consider the use of a script in its simplest form that can scrape the data we want and reduce the time expended to manually go through links one by one. For example, a Python script can be used to extract such information, but in the event of a dynamic website, we may want to consider the use of libraries such as Selenium for automating dynamic interaction from sources that have paginated data sources, and numerous options for selections. Let's take a look at the simplest of these in the following. This may take some time, we might have to allow it to do its thing and come back at the end. Don't worry about the messages that you're seeing there. Is because here in this lineup here you have it, you can see it has ended. It says your search was successful. Check the extraction folder for the output CSV. Wow, that was interesting and can be developed upon to do even cooler stuff. Having collected the data, we now have to think about where it will be stored for analysis. There are various types of databases and service providers out there. Namely, we can look at MySQL, PostgreSQL, DB2, Google Sheets, Oracle, Amazon Redshift, SAP HANA, Azure Synapse, Druid, and Pinot. These are only a few of them, but there are many, many more out there. So we need to consider what type of tool we can use that can leverage and receive data from all of these sources if need be. For our analysis, we will take into account that we would like to have a tool that is capable of integrating and ingesting data from disparate storage engines and forms. In particular, we have chosen to use Excel, Microsoft Power BI, Jupyter Notebook, and Apache Superset. As you will see, they each played a pivotal role in getting us to where we want to be. You may ask yourself, why combine so many tools if each one of them can perform the task on its own? Now, there are benefits of using each of them at the various stages to get a comprehensive understanding of the data and leverage the advantages of each tool. And for this purpose, we decided to begin our analysis journey using Excel. This allowed us to gain a quick glance at the data and quickly determine the amount of columns that we're working with, take a look at the data types, and make a decision on the way forward for the analysis process. After using Excel, we looked around the data using Power BI. As you will see in a bit, it is quite easy to make various transformations with the use of this tool. The steps that we use in the preprocessing in both Power BI and Jupyter Notebook entails the following, but some of them may be skipped in Power BI. We can begin by loading the data, checking the data length, do an initial statistical description using methods such as describe data. We can check the row and column indices for null and blank values, find columns with null values, get the number of rows with none values, or in other words, blank data values. We can get the percentage of records that are empty. We can also retrieve the records with missing data, remove leading and trailing white spaces, remove special characters such as full stop and then the white spaces if there are any others. We can also change column names to the appropriate data wrangling format that we prefer to use within the visualization software. We can also check for duplicated rows and if found, place them in a separate data frame for reference. It was noted that in some columns there was the UKN phrase within the data values which represented unknown information. For example, this was contained in the age column and that would need to be replaced with a blank. We could not put the 0 because the 0 is a valid data value in this case and we did not want to skew the information. We could also retrieve the different column values for vaccine type old, replace incorrect column value from step 15. Validate the datetime field, convert to user-friendly datetime format, drop the column vaccine type old as it is a duplicate of the vaccine type. We also created an auxiliary column for the age at vaccination and filled the null values from step 20 with zeros. We created an additional column called age groups and thereafter output the data that we have processed into CSV format. With the use of Power BI and Jupyter Notebook, it was possible to accomplish the following. Have a look. We spoke about the ease at which you can transform information within Power BI. When you enter into Power BI and you load the data and you select transform, this is where you would come. As you can see on our right here, these are all the steps that I've performed on the data set. I've promoted headers, changed the data type, renamed columns, remove columns, rename columns, change the type, replace values, and change the type. Now, any of these steps that we have here, I can click the X, and that would easily delete a step. For example, if I click on this drop down arrow for those, I can see all the different values that are within this column. So we only have those one and those two. If I only want to see those two, I can uncheck select all and I can click on those two and click on OK, and I would only see those two values. Now those two are row values. Now if you notice that there is no longer any those one, I can simply remove that filter that I've placed by clicking on the X there and deleting that step, and my data is back to the original set. You can easily see the data value of the columns that you're here in by glancing at the top here where it says data type text. You see it's text again, it's a whole number there. This is a datetime value. You see it's very easy. You can remove rows, keep rows, remove columns, choose the columns that you want to keep. You can split columns and you can group by. There are numerous things that you can easily and quickly perform within Power BI. We're now going to take a quick glance at the Jupyter Notebook that we used to do the pre-processing of the data. Here you can see that we loaded the data that was provided. We then check the data, the length of the quantity of records that were contained in the data file. We describe the data. Here we're searching for null columns and rows, and if there are any empty, we're returning the quantity of empty rows and the percentage of rows that are empty. We would also place the missing rows into a data frame so that we can use it for a reference at a later time if we choose to. We're changing the name of the columns there. Here we're creating a new group for the age groups, and then we output it into a CSV. I can actually run this again for you. And it has provided the same information that we were just seeing. The results of our pre-processing and descriptive analysis showed us that the dataset contained a total of 293 records. There were no completely blank rows entries found. None of the rows or column entries contained blank values. There was a 0% of records with empty rows or empty column values. There were 5 records that contained the value UKN indicating unknown age. 1.7% of the records contain the value UKN indicating unknown age. The minimum age is 0, the maximum age is 80, the mean age is 33.41, and the mode age is 6. You can have a look at the figure here that shows the descriptive statistics that we were able to retrieve after taking into consideration that some of the rows for age were not known, and we removed those values so as not to affect the average that would be calculated. We then moved to use Apache Superset for the visualization of our charts. The advantages of using Apache Superset includes that it provides multiple data source connectors. It is easy to configure alerts and reports. It allows the emailing of reports. You can be provided with role-based and row-level security. You can customize with company logo, and you can upload new data to databases from within Superset. With the use of Apache Superset, it was possible to accomplish the following. Moving on to the Apache Superset platform, where we did the visualization and analysis of data, and where we can see the various charts and dashboard. Here we can see that we are in the dashboard that was created. We have the general stats tab, where we're providing general data about the um, general information about the data that we've collected. We have a total of 293 records. We have 4 center locations. There we have 2 different types of vaccines that are offered by the HSA according to the data set. And here we have a table with the names of the centers and the vaccines. We also have a tab for patient care, whereby we get into some more statistics. We're showing the number of patient records. Here we visualized all the patient visits records for the vaccinations. Here we are seeing the vaccines that were used in the cases. We've provided the numbers and the percentage comparison between the two. We've provided a breakdown of the vaccine distribution by year. Currently there is only data about 2021, but if there were other years, you would see the other years appearing in the legend here, and there would be a stacked bar according to the year, right? We can also see a vaccine distribution by type across the different age groups. So for the Pfizer BioNTech, we have the different age groups here as shown in the legend, and for the AstraZeneca, it's the same. You can clearly see that the Pfizer BioNTech is more used than the AstraZeneca. If we go to the COVID-19 dashboard, you can see some more information about the vaccination. We've classified the vaccination by the age group. You can see that for age group 25 to 49 years, they're the most vaccinated, and it goes down the line for the different age groups. We also have the vaccine use um, by age group. So we have it as a stack bar in this case for easy comparison between the 2 different vaccines available. We have the vaccination by location here in a table format, and also some horizontal bars that can easily allow you to see which value is the highest. We have the number of vaccinated at location by type. So for the different locations, center 1, center 2, center 3, center 4, right, we have the number of persons that have been vaccinated here within the totals, and then we have further broken it down by the type of vaccine, and we also have the totals here at the end. We can also produce reports within Apache Superset. So here you can see that I have some reports that is intended for weekly distribution. Currently there are 2 charts in this weekly report. We have the vaccination by week of year. So at present, the data that we've worked with only have data for week 1 of 2021 and week 4 of 2021, right? We have also done a cumulative frequency diagram against the bar chart for the visit over the different days. We've provided some text for added clarity about what the dashboard and the report is about. We've provided some links here so that if you would like some more information, you could actually click on it and you will get it. These reports as a sample, we will send it out to each member of the panel so that they can have a view. We have also provided logins for each of you to get into the platform, right? I will subsequently share the the passwords for you to get into the platform. As a monthly, we can also have a monthly report. So we have done the monthly report for the month pertaining to January 2021. So we have done our write up here. We have the charts that the write up is referring to, right? And made some, we've also spoken a bit about the findings and recommendations about the data. So for the findings, it is possible to improve on insights generated with the capture of a richer dataset. This can be done by an increase of the variables used on the forms throughout the healthcare system. There is a possibility that some of the required data is being recorded but not collected at the level of the HSA Statistics Office for inclusion in the reporting dashboard. To note, it would be important to capture data on the actual COVID-19 cases and track the cases throughout their life cycle, from reporting to investigation and treatment. On this point, some key data variables would be to capture the data report was made by the affected individual, the data report was handed over at the national level, the date the investigation began about the COVID-19 case, the outcome of the case, whether the person recovered or if they died or if they suffered any severe deformities as a result of the contracting the COVID or any severe complications, the date of birth of the affected individual, the age at onset of the event, the medical history of that affected individual, the use of appropriate ICD and metric codes for the recording of the medical history and medical information, the pregnancy status in the event that it is a female that is being affected by the COVID, the day the investigation was completed, the location where the patient was seen, the location where the patient was vaccinated, the doses received by the patient, vaccine data such as lot number, manufacturer date and time given, and expiration date, the doses administered to the population. Right now, the tracking of such data can assist in the early detection of adverse events that can negatively affect an individual's and public health. This negative effect would potentially reflect negatively on vaccination campaigns, thus, early detection can be a mitigating factor on the before mentioned negative effects. Medical personnel should receive training on the use and importance of the forms, training on the use of ICD and measure codes for recording of clinical data should be taken into account. So, from this, we can see that it is easy to provide a monthly report and provide clarity on any of the charts that you're sharing within your dashboard and that are of interest for dissemination. And these dashboards can be set to be automatically emailed to various recipients at a given time. For example, if I want to set a report for the monthly one here, if I go here, I can use this option here and fill in the different values here and schedule an email report to be sent out, right? Within Apache Superset, it is also able to easily provide row level security and role based security. Now, each of you are provided with login details. You would notice that, for example, for the finance department, only the finance manager will have access to that data. For the human resources, only the human resources will have access to it. Generally, the chief information officer, he would have access to all of this general, the patient care, the COVID-19, um, everything that's here, he would have access, right? And any user for data analysis who requires the use of different information would have the appropriate privileges for the viewing of information. We have also come across the inclusion of disparate data within the platform. So what we have done is, for example, within the finance department here, we have included some additional data that wasn't provided, and this is data, some sample data that can be used to show um, how billing information can be linked to other information. So, for example, we have a table here for the medical cost. Now we can easily link this data to, for example, the patients that were coming to the centers for care, and we can say, for example, we can see how much they had to pay, and in this case we can link them by the unique numbers. And what you would notice is that we've produced another table here that has the today's presentation. We covered the statistics that are important for the Health Services Authority. We looked at the steps that we use to provide statistical insights, how we collected the data and integrated it into a database. We looked at the cleaning and pre-processing phases. We also took a look at descriptive analysis and the insights that were generated from our analysis, and we made recommendations based on those insights. We have reached the end. Until next time, thank you and have a good day.